Welcome back to the Morning Blend. If you're like me, whenever a doctor recommends something, I always ask, well, what would you do? Or would you tell your wife to get that? Well, today we've assembled a panel of 4 docs in cosmetic and plastic surgery to get real with us and share truthful insider opinions about treatments that are now available. Please welcome Dr. Deborah Manjoney. She's with the Wisconsin Vein Center and MediSpa. We have Dr. Joy Davis with Defying, and Doctors Tom Korkus and Chris Hususian with Plastic Surgery Associates. What's up, guys?
What's up?
Well, we're just here.
This is quite a panel.
Questions.
I like that. This is quite a panel we've assembled to have all of you come together. And the reason is because you're going to be together a little bit later this month on a Saturday, and people can come and hear everything you have to say and ask questions themselves, right?
That's right. May 21st. At 7:30 at the Country Springs in Waukesha. We are doing a seminar till about noon where we're going to let you ask us questions and ask things the audience wants to know about what works, what doesn't in the field of aesthetic medicine, cosmetic surgery, because we think there are a lot of things out there that people want to know. I
think so too. And I got to ask the plastic surgeons here. You go to a cocktail party, I always wonder this about what you do. What do people want to know when you're like, I'm a plastic surgeon?
What do they don't want to know? As soon as they find out that we're cosmetic surgeons, it starts and it doesn't end. And the deeper you get into the cocktails, the more aggressive it gets, you know. But there's no question that we're enthusiastic about what we're doing with Defying Gravity. And Debbie's been in the business for a long time. My partner Chris and I have been doing this for a long time. Joy has now entered the industry. And we felt as a group it was very important to educate the public about cosmetic medicine from skin to surgery.
Yeah, let's talk a little bit about that. Let's kind of just go through just quickly what you do.
Right.
So you're at the Wisconsin Vein Center and MediSpa.
Correct. So I do minimally invasive and non-invasive treatments for vein disease, varicose vein disease, but also the entire gamut of laser resurfacing for the face, Botox fillers, permanent hair removal with lasers. We're doing skin tightening with all kinds of radio frequency and heat devices. So really I'm doing the non-invasive cosmetic things that people perhaps want done before they even consider doing anything more aggressive, more invasive.
Like surgery.
Like surgery.
Which is wonderful. And the thing is, you stay on top of the latest,
right.
What truly gets people results. I mean, how about you, Dr. Joy? You were an OBGYN formerly, right?
I'm still an OBGYN. I have a with a private group, and then I started another company called Defying because there's a growing field of feminine rejuvenation. And that's a really exciting new thing that I'll be introducing at the seminar.
Some of the things you talk about are incontinence, right?
Yep, incontinence, vaginal dryness, atrophy, sexual dysfunction.
Pelvic floor disorders.
Pelvic floor disorders, yep.
Yeah, which is, there's a lot of exciting, minimally invasive work that can be done, and recovery I know is quick, which I'm looking forward to sharing that with people too.
Yes.
Dr. Korkus, talk about what you do at your practice.
Well, we are a full-service cosmetic center, and as Deb does, we have the appropriate lasers for treating fat reduction and laser resurfacing of the face. We also do Botox and fillers. But at the same time, we do have a Medicare certified operating room attached in the facility, so we can move to the operating room if we feel that somebody would not benefit from less invasive procedures.
Do you do what's called the mommy makeover?
We see a lot of mommy makeovers. It's probably one of the most popular surgical procedures that women are having done.
And what is that? A breast lift,
well,
right? And a tummy tuck?
Breast surgery, tummy tuck, and liposuction.
I can see why it's popular. How about you? And you guys work together.
We work together. We do the same thing. We work together in our facility. Sometimes we even work together on the same patients. You know, Tom and I will often see patients together if it's a particularly difficult problem or a particularly large surgery. And so we have that kind of a partnership, which really helps and is not really very common in plastic surgery.
And you do facial plastic surgery as well. So you treat the nose, eyelids.
Eyelids, brow, nose, face.
All those kinds of things.
All those areas.
Is there something that's new and exciting as it relates to facial plastic surgery?
Really, in our field, it's always evolving. And lately, what we're doing a lot of now is fat injections in the face. So it's rare that Tom or I will do a facelift or other facial surgery where we're not injecting some fat. Excuse me.
Because that gives people volume back, right? Because as we age, we tend to lose volume.
Right, and that's really been a tremendous advance, I think, in natural-looking cosmetic surgery, as well as non-invasive treatments, that we realize that the face loses fat, so it's not enough just to tighten the skin. We want to rejuvenate by adding volume back into the face.
So in the old days, the classic facelift was just elevating the skin and lifting it. It's gotten much more sophisticated now, and if you go to any of the recent cosmetic meetings, it's about lifting and filling.
You know, sometimes when we do segments on defying gravity and doing things to look more youthful, we'll be criticized by people who say, what's wrong with aging gracefully? And the thing is, that's fine.
It's absolutely fine, and it's everybody's individual choice. We do things that are less invasive than Tom and Chris do, but at the same time, it may not be the right thing for that person. And so, you know, we want to offer a spectrum of options that are available, including just good skincare. So, you know, that people can know what they might want to use, where they fit in on the spectrum of what they'd like to do in order to stay looking young, feeling good about themselves. That's what it's really all about. I think we are all in the business of making people feel good.
And there's no reason, you guys deal with women, I'm sure, a lot as well as men, but there's a certain guilt, I think, for women in wanting to look younger and feel better about the way they look. And I bet part of what you do is a certain amount of, not psychology, but telling people, hey, there's no reason to feel bad about wanting to look your very best.
Yeah, well, when women come in and they want cosmetic surgery, they feel they may be being selfish. But that's not the case. Everybody wants to look as nice as they can. And the reason that we're doing this the Defying Gravity program is because when we want to educate the public, get them into the right hands so their experience is positive. Because when you have a positive experience in cosmetic medicine, it gets addicting.
Yeah, and one of the things I know we're going to talk about is the qualifications that you all have and the highly skilled people that you employ as well. I'm excited about this event that's happening. It's Defying Gravity. There's going to be breakfast is included, and there's some amazing giveaways as part of this too. I know you're going to want to attend. You can ask questions. I'm going to ask them a lot of questions about what they would do and would they recommend it to their wife. Is aging pulling you down? Well, then be sure to attend Defying Gravity. It's happening Saturday, May 21st, starting at 7:30 a.m. with check-in. Get a little breakfast, some giveaways you can register for until noon. It's at Country Springs Hotel in Waukesha. It's only $15, and you can use that and apply it to a service or a product that day. DefyingGravity360.com is the website to visit for more information. I will see all of you guys very soon. Thanks so much for
We look forward to it. Thank you.
I'm looking forward to it. Thanks.